Hi, I'm Dr. Kit Weathers, and this is the Root Tip of the Week. And let's begin with a little magic. Here's a little magic with a simple rubber band. If I slip it over 2 fingers and snap my fingers, watch it jump. I can even make it go back. Now let me show you how that's done. It looks like I placed the rubber band over 2 fingers, but from the back. To learn the secret to this and other magic tricks on this series, please go to EndoRootCamp.com. Well, I certainly hope you enjoyed this week's magic trick. Right now, Root Tip of the Week. One of the attendees at my most recent root camp sent me a couple of radiographs illustrating a problem that he'd had. The first radiograph shows a very nice job of fitting his master cone, but the second radiograph, even though the apex is nicely sealed, there is a series of voids along the way. And what I'd like to do now is show you this void and these little bubbles along here on this other tooth, and if you use a single cone technique, how you can avoid having the same problem in your own office. Before we talk about how to fill the canal and not leave voids, let's take just a moment and discuss single cone versus lateral condensation. I was trained in lateral condensation, and we used to see how many gutta percha cones we could place in any one tooth. However, if you really think about it, all obturation techniques are single cone in the last couple of millimeters. So here's what we do. We fill the canal with sealer, and this is where most people make their mistake. One of the things you have to remember is as you withdraw the spiral that's placing the sealer in the canal, keep a tip of that spiral against one of the walls of the canal and pull it out slower than you're injecting the sealer. If you pull it out too fast, you'll leave that little space we showed you earlier. So the next thing we do is place our master cone that's already been pre-fitted down in the canal. Here's an example of a tooth that's got a void about halfway down the root, and this was caused by pulling the spiral filler out too quickly, leaving that space. If this occurs, you can always go back and add more sealer and float the bubble out, but the best thing to do is keep the tip of the spiral filler against one of the walls of the canal as you slowly withdraw it, allowing sealer to go in faster than the spiral comes out. And here's the final fill, gutta percha in place, and we see what a nice dense fill we have. And this is how you get perfect condensation and nice lateral fills with a single cone technique. Don't forget, when you fill the canal, take off the excess down to the CEJ or a millimeter or so below so you don't stain the upper part of the tooth. Well, that's it for another edition of the Root Tip of the Week. I'm Dr. Kit Weathers, and I will see you at the next Endo Root Camp.